Hi, I am Mboweni, a registered dietitian. Today I'll be taking you through diabetic retinopathy, which is one of the microvascular complications of diabetes. What is this diabetic retinopathy? Diabetic retinopathy is a microvascular disorders that occur as a result of long-term effects of diabetes resulting into vision loss. Diabetic retinopathy is a common complication of diabetes, which affects about 35% of people living with diabetes mellitus. Now I'll be taking you through the causes of diabetic retinopathy. Diabetic retinopathy is caused by chronic hyperglycemia, which is hyperglycemia refers to high level of sugar in the blood. So the high level of sugar in the blood damages the inner part of the blood vessels or the endothelium layer of the blood vessels and causing these blood vessels to dilate. And when the blood vessel dilate, there will be a loss of this peritocyte. And if the peritocyte is lost, then because the role of this peritocyte is to hold the artery into structure. So if this is lost, then it results into outpouching of the ballooning of the retinal arteries. The ballooning of the retinal arteries look like this, and this is called a microaneurysm. This is the first stage of diabetic retinopathy. I will now be taking you through the screening procedure for this condition. As you can see, the optometrist is holding an ophthalmoscope and check into the eye of the patient to assess or check for disorders related to diabetic retinopathy. So, how often should one do this particular screening? The screening should be done for type 1 diabetic patient. The screening should be done from 5 years after the diagnosis, and then from there it should continue annually. And then with type 2 diabetic patients should do this screening immediately from diagnosis, and then from there annually. The reason for doing it from diagnosis with type 2 diabetic patients is that the condition might be silent, or you might have the condition for a prolonged period without knowing that you have the particular condition. And by the time of diagnosis, you find out that you have been having the condition for a prolonged period and it has already caused the complications. Now we are moving to the stages of diabetic retinopathy. The first three stages are mild, moderate, and severe non-proliferative diabetic retinopathy. And the last stage is proliferative diabetic retinopathy. In the first stage of diabetic retinopathy, as I've already explained, that there will be aneurysm, which is that outpouching of the blood vessels. And in the second stage, there will be heart exudates available and also hemorrhage. And then also the third stage of this condition, there will be all these three: microaneurysm, heart exudates, and hemorrhage. So it just differ with the areas affected by these signs or the quadrants of the eyes that are affected by these signs. And then the last stage is proliferative diabetic retinopathy. This stage is characterized by formation of new vessels. So this is the last stage that leads to severe impairment of vision. What are the symptoms that one will present with when having this particular condition? So the first symptoms is blurry vision, where a person can't see things clear. Most of the things that you look at, they are blurry. And then the other signs is floaters or flashes, where you see a dark cloudy floating in your vision. And then the third symptoms is poor night vision, where it can even be dangerous for one to drive during the night. And then the other symptoms is impaired color vision, where it is difficult to differentiate colors. The last symptoms or sign is vision loss, which can be partial or total loss of vision. What are the preventions or management of this condition? As I have already explained, that this condition is caused by chronic hyperglycemia or high blood glucose level. So the best treatment or prevention method to this condition is to control the blood glucose level and also to control the blood pressure, as the blood pressure can contribute to early development and to fasten the progression of the condition. And also to quit smoking, as smoking it's one of the risk factor of the condition. How do one control the blood pressure and also the blood glucose level? This is controlled through diet, medication, and also physical activity. So when it comes to diet, it's where we promote that people must take foods that are low in glycemic index to reduce the intake of fat, especially the saturated fats, and to reduce the sodium intake, as sodium can contribute to high blood pressure, and to also limit the sugary drinks or sugary products. And also we talk about exercise, of which we recommend that a person must exercise at least 150 minutes per week. So this time can be divided into days, maybe for instance 30 minutes per day. In the final analysis, it is important for the general public to screen for diabetes, and it is important for people living with diabetes to screen for diabetic retinopathy. And also, prevention is better than cure. So it is important to prevent for the development of this condition by following proper preventative measures. And for those who already have the condition, it is important for them to follow the proper remedial actions, which are dietary practices or lifestyle modification, including good dietary practices, physical activity, and also to take the medications as per the prescription by the doctor. Thank you. Until we meet next time.